Hi, Vincent. It's a pleasure to have you here. Thank you.
Yes, it's a pleasure to be here.
So, Kaiser Permanente, obviously, very big influence, especially in California. You are the chief data officer for that, a very important role. I want to start with understanding because AI is going to have, I think, the biggest impact in the healthcare segment. When you represent as big a company as Kaiser, some of the top level things where you try to understand how you can absorb that, mitigating the risks and the opportunities it presents for your patients and your customers.
Yeah, I mean, I'll speak as a physician first, which is the opportunity to bring health and well-being to patients is our North Star. And I think it's critically important for us to find tools that are effective, that reduce the barriers to effective healthcare, that are safe and secure, that retain privacy for our patients, but ultimately make the interaction with the health system more human. So even though there's more technology layers infused, it's to draw humans together in that all-important nurse-patient or doctor-patient relationship. And so that's the kind of technology I think that organizations, startups will have an incredible market to develop for.
Coming to technology then, like I said, it's very important decisions you have to make, and it's not just because of AI. I mean, it's been going on and like I said, it's one of the few major verticals where technology is heavily applied to make an impact. And technology is not just because of ease of doing work, but also for the betterment and care of the patients that you look after. So some thoughts on that.
Absolutely. I think the things which make patient care better, more effective, that restore health are going to be our top priority. There are also a lot of tools for back office, for automation, for making the business of medicine better. And ultimately, I see tremendous growth opportunities in patient-facing applications. There is such an information asymmetry right now between patients and healthcare, both from an understanding as well as an access and getting through the red tape. I think AI will empower patients tremendously to have tools to be able to navigate the health system in more effective ways.
If I may ask you to give us a couple of examples in layman's terms for the patients to understand how AI is actually going to benefit them in terms of leveraging the technology.
One example that I like to use is ambient AI. So it sits in the background, it listens to doctors and patients as they talk, it transcribes that, and then it summarizes that into a medically and a patient consumable piece of information. Now, that itself doesn't drive improved outcomes, but what it does is it removes the computer and the clerical burden of documentation between a patient and a provider, and it allows them to have more empathetic, more compassionate, and more effective communication, while also reducing cognitive burden and burnout for our physicians. Other examples are AI that look through your medical chart in order to alert us that there may be a high-risk condition. For example, in our hospitalized patients, there are AI analyzing patients on an ongoing basis in order to identify patients who might be at risk for deteriorating so that we can send out teams of nurses and doctors to check in on them. So it's providing a safety net for us in order to make sure that the patients are most effectively cared for. Our data showed that saves 500 lives per year across Northern California. So it's really that careful application of secure and effective technology that can save lives and make patient and physician interactions more meaningful.
Well put. Appreciate that. Patient care, as we all know, at the core of it, and technology is enabling all of us to make lives better. Thank you for being here. Appreciate it.
Thank you for the invitation.